following a break for April, where we had Easter and Ramadan break. This morning, we are going to have a very touching subject which affects many of us. We are lucky and blessed to have many of you attending. Thank you so much for joining. I hope you all had a nice Easter and a Ramadan Kareem. Yes, we are back on every last Saturday of the month at 10 a.m. to share richly your experiences and tips on the subjects which concern all of us, intending to age purposefully. Today, we have sharing, very rich sharing from a topic which, as I said, is dear to us as older adults. That is tips for the caregivers who care for the those affected by Alzheimer disease. I'm not going to attempt defining what Alzheimer is, but we shall get a good definition, relevant definition from one of our speakers. As you all know, usually we have different types of caregivers, those who stay 24 hours with the patient or with the client, and the rest who are mobile and administrative, financial muscles, who are usually the relatives of the elder person, and are the ones who are visible, like taking care. But there are people among us who stay 24 hours looking after the older adult. These are the people we are trying to focus on this morning, and we shall just call them caregivers. You can choose to fall in any of the groups to share this morning with us. Yes, we are supposed to have Mr. Fred Mukasa. Mr. Fred Mukasa is a nurse for old adults, or call it elderly. He has a 10-year experience working with the older adults. And among them, most of the time they have Alzheimer, amongst other diseases or other disorders. Mr. Fred trained in the field of taking care for the older adults. He has experience over 10 years taking care. He has experience working in different parts of the country, Uganda, and also had training based in Nairobi, Kenya. He will give us tips of how to care for the caregivers themselves, himself. The second speaker is Mrs. Joy Louis Gumikiriza-Onorio. She's a lecturer and a clinical psychologist at Makerere University College of Health Sciences. She specializes in mental health, gerontology, that is the study of the old, and also specializes in care of individuals with Alzheimer's disease and related dementias, abbreviated as ADRD. And she has a long experience, and I'll let her actually elaborate some of her experience and works in different parts of the world, but basically to do with brain health or mental health and for caregivers. And this is particularly of interest to us this morning. She has done a lot of work, particularly among caregivers in Uganda. She has extensive research experience, and we are blessed to have her this morning to share with us. As you all know, these sessions are usually interactive, so please feel free to answer questions, feel free to give comments, feel free to leave comments in the chat box, or if necessary, put up your virtual hand so that we can all share in this morning session. I'd like to just make sure Fred is with us, and if so, can you please start on your topic this morning?
Fred is not yet on, but maybe joining in a few minutes.
He will join in a few minutes?
Yes. Maybe Joy can start and Fred can maybe talk during the Q&A if there's anything to add.
Okay. So Joy, would you like to start off with defining or telling us what is it? What is Alzheimer?
All right. Good morning, everyone. This is Joy Louise Gumikiriza-Onorio. Thank you so much for the introductions and for inviting me to be a part of this talk today. So I'm just going to give us just a brief overview of what Alzheimer's is as we wait for Fred, and then we can see where to take it, how to take it on from there. Okay, let me get my video off. I hope I am clear enough and everyone is able to hear me.
We can hear you, Joy.
All right, thank you. So today we're here to talk about understanding and supporting Alzheimer's patients. But the understanding and supporting part, I think we'll delve into it when the time comes. So let us just try and get to know, briefly what Alzheimer's disease is. So Alzheimer's disease, just like any other disease, usually has a sudden onset, but it's progressive. It begins with certain characteristics that you see, certain changes in the brain, and these keep growing. So that's why we say it is a progressive neurological disorder that causes brain cells to degenerate and die. So when these brain cells degenerate and die, it leads to a continuous decline in your cognitive functioning. It has quite a number of symptoms, but the key major symptoms that we usually see are memory loss. And when we say memory loss, it can be that they're not able to make new memories, or it could be that they have forgotten a significant part of their lives, but at times they remember just a few things. But then also they forget, you can have a conversation with them, and within a few minutes, they're not able to remember or have any recall of that conversation because they have not been able to form that memory. They also present with confusion because at times they are disoriented in time and place. They're not so sure what day it is, what time it is, or where they are. They lose the ability to know. For example, many of us here, you're sure that today is a Saturday. You're sure that it is about 10 a.m. if you just looked outside, or without even checking on your watch for the time. But for them, this is difficult. It's very difficult for them to know this. Everything just seems they're kind of in a blur. And then they also have difficulty with coordination and special orientation. Now, this also comes in with judgments. Some of them, they make okay, of course, every now and again, we all make some judgmental mistakes, but for them, it's kind of the norm. Their judgment is very, very impaired. For example, if they need to use the toilets, they might lack the judgment to know that this is now the time for me. The message I'm receiving is for me to use the bathroom and possibly susu or to pass stool. So they will do it on themselves. Or you give them a plate of food, and after using the food, or some of them can pour the food down and then put the poop on the plate, but not all the time. But then we also see challenges in their personality. Some of them become extremely irritable. They can present with some hallucinations as well, both visual and auditory, or even tactile hallucinations. They become extremely paranoid. Many people have reported that their loved ones tell them, if anything is lost, they always are accusing people around them for having stolen either their phones or stolen their money or stolen something. So they also present with changes in their personality and many other symptoms. So it's important for us, if we're taking care of them, it's important for us to know what we are dealing with, what they are presenting with, and to also know that many of these things are not intentional things. They just happen. It's part of the progress of the disease. So Alzheimer's disease and other dementias, Alzheimer per se, is a subtype of a dementia, dementia being the umbrella term of all these neurological disorders that we see in the elderly. So the Alzheimer's disease is the most common dementia that we see. There are also others like dementia with Lewy bodies, there's the cardiovascular dementia. We also see Parkinson's dementia, but the most common one is Alzheimer's disease, though at times it's good for us to just take it as a whole, because when it comes to the management, apart from the specific symptoms that differentiate them, the management, the caregiving is more or less the same. So these dementias, by the year 2030, in Africa alone, we'll have about 7 million people who are suffering with a type of dementia. And 2030 is not far away. But we also see that the increasing burden of this disease is steadily being noticed in our setups in low and middle income countries, and we are steadily taking up the lion's share of the number of people who are struggling with dementias and Alzheimer's disease. So we also see that the World Health projects that by the year 2050, we'll have about 15.8 million people living with dementias including Alzheimer's disease in Africa. But in the whole world, about 131.5 million people will be living with these diseases. So when we look at this, we see that this is becoming a significant issue that we all need to pay attention to. We all need to brace ourselves for it and accept and see how best we can support our loved ones when they get into this state where they have Alzheimer's disease. So I'd like to stop at this point with a brief overview. I don't know whether Fred is here, but we can have a bit of questions and answers just at this point of understanding what Alzheimer's disease is.
Thank you very much, Joy. Thank you so much for this elaborate definition. I hope this augurs well with many of our caregivers who are online. Basically, this thing is not far from us as elders. You heard the word progressive. So your questions of where's my phone, where are my glasses, where's my car keys, where's my everything around you, believe me or not, is the beginning of it all. And as Joy has ably put it, the end results are unable to control this, unable to remember this, and all that. I noted that most of the actions are unintended. So don't feel guilty when you forget this and when you accuse others around you having taken your money, taken your what. You actually do not intend it. So caregivers, please take note on that. I think Fred is on. Good morning, Fred. We are happy to have you. Good morning, Fred. Fred, I've made a brief introduction and you could just dive in. Tell us about how you handle challenges or any challenges you face when you're taking care of the elderly, especially those who have Alzheimer. Please unmute and dive straight in.
Fred is on, but looks like his microphone is not enabled.
Hello, Fred. It's your time to talk. Hello. We'll get there. Mr. Mukasa, kindly unmute and share with us. Challenges you face as a caregiver. Okay. Fred, are you picking us? Dr. Philippa, do you want to talk to Fred on the side while I think we'll have to have Joy continuing? Dear participants, do you have any comments on the brief description of these degenerative diseases as described by Joy? Any comments? Yes, I can see Salita asking if she would like to know if we have facilities in Uganda that attend to specifically this category of elder. If yes, where are they located? Joy, would you like to take that? Are you aware of any facilities that take care of the elderly?
So at the moment, most of our caregiving, like you're going to see in my other talk, is really familial. And from the different studies that we've conducted so far, we even these family caregivers, they just find themselves taking care of this person, or the family agrees that so and so will be the one to take care of the individual. So what happens is when the patient is unwell and you notice certain symptoms, that's when you take them to the hospital to be treated. That is if you can. But for some other people, they don't do this. They focus on the herbal medication. So there's not really like a home or respite care for the elderly currently in the country. But now that we are starting to delve into this area and in the field, I believe that there's hope, like that in the near future we should be able to have people who come up and have some of these homes. But at the moment, I'm not so aware. I think there's a few. I don't know whether it's really for Alzheimer's disease, because I know, for example, Rotom. I don't know whether we've heard about Rotom. Reach One, Touch One. I don't know whether they do the elderly. They work with the elderly. I think I've also seen something like, is it Golden Homes? But I don't think they focus so much on Alzheimer's disease. I think it's really general elderly management at the moment. I know there's a particular home, I think in the West. I saw something in the West, in southwestern Uganda. I forget the name. Who that also have like an organization or some homes for older people, but I've not really come across one that focuses specifically on Alzheimer's disease and other dementias. I think it's all general. So, but yeah, maybe Mr. Fred can add a little bit more light. But yeah, we also have organizations like the one we are part of, like Purposeful Aging, that should be able to guide us on, when you have a problem. I believe we can reach out to Purposeful Aging and they can guide us on where to start. Not that they have a home for the elderly, but they can guide us on where to start.
Thank you so much, Joy. You're very right. We have several homes or treatment places for the elderly or the seniors. You've heard of the Kateyamba, Tirubaga. They're basically church-based, both Catholic and Church of Uganda. There's one in Mukono, used to be run by the late Archbishop. There are several, but as Joy has put it, it's not specific for Alzheimer, but you get all the assistance that the country can actually offer at present. As for purposeful aging, we do not have a home yet, but we've got the contacts. Dr. Noelina and Dr. Dennis can give us a lot more on this. We've had touch with Dr. Mosisi's hospital, Segane in Entebbe, but all these are usually for, you could say, care and diagnosis, and then basically you go home and you are taken care of by relatives. There are several individuals who actually take care of relatives, who are not relatives, but patients or elders, but not specifically in a center, but she visits them in their homes. It's like a consultation. So basically, in Uganda, we don't have a special home for Alzheimer, but we are beginning to have places where one could seek care. And as for the diagnosis, I think that one we can only recommend that you check with mental health and other physicians as usual. As a normal patient, we do not have a special center for Alzheimer diagnosis. And for, I think in the rural areas, it's still at the stage of just saying obulwadde bwa bakadde oyo mukadde. They don't even bother to give you special attention that you need to go to a hospital. They just classify you as mukadde and leave you at your veranda. They pull you to the sunshine in the morning and pull you back in the evening. They don't really recognize this as something that we do need to take care of. Afraid I'm not sure that you're able to talk now, but if you are, you can add on anything from your experience in Zambia and all that. Yes, Fred, you are still unable to talk to us, I think. Joy, can we continue with you, please?
All right, so let me just share my screen again. And we can continue. So now we're going to delve into the reason we are here today. And that is to understand and support patients with Alzheimer's disease. We've already had an overview of what the disease is. So now allow me to get into understanding these patients and how we can support these patients. Someone's hand is raised. Dr. Christina, someone's hand is raised. I don't know whether they have a question right now.
Okay. Can you please unmute and share?
Good morning, everyone on call. Clear?
Good morning.
Yes, Peter Secharanda is my name. I want to appreciate and thank everyone, especially the topic that is being presented today. It's very pertinent to many of us. Why I put my hand up, I have a colleague I work with in Soroti. She's on call. Maybe later, if time allows, I'll request the chairperson to allow her maybe 2 minutes to talk about what she does with the elderly. She has a CBO looking after the older persons in Soroti. Just so that maybe the wider audience on the group can know that out there are still people who care about the older persons. Thank you, Chair.
Thank you so much, Mr. Sekiranda. Yes, we are going to have an interactive session, so rest assured we will hear from her or him. Yes, Joy, we can continue.
Okay, thank you very much. We had already gone through what Alzheimer's disease is, and we know that it's a progressive neurocognitive disorder. So in order for us to manage these individuals that have Alzheimer's disease, we need to be informed as caregivers. We also need to be empathetic as caregivers. For example, sympathy is when we acknowledge that someone is distressed. For example, like you see in the picture there, I'm sorry for your loss. You're acknowledging that someone is in distress. But empathy, on the other hand, is actually understanding how someone else is feeling. So you cannot be an empathetic caregiver for a patient with Alzheimer's disease when you don't understand the emotional and psychological state of this patient that is having Alzheimer's disease, because this is very, very crucial. In some of my studies and some of the people I've worked with, before we start them on the training for caregivers, they will tell you, you know, for me, I get disgusted, I get annoyed, I get really angry. So when I do that, when I get angry, I just feel like, you know, running away or abandoning the older person or the patients. This is because they have not understood what the patient is going through. They have not understood even the symptoms of the patient. So this causes frustration. We're human beings. We can really get frustrated. So the first part in being a caregiver to the individual who has Alzheimer's disease and other related dementias, allow me to call it a DRD going forward, is for us to understand their emotional and psychological states. But we also need to be informed. We need to be knowledgeable about the disease progression. You cannot manage something you don't know. So you need to be informed. We need to attend trainings, read, get some information and read, and just ask the doctors, when you come in for review, talk to us, let us teach you as well to know what the disease is like, to know how this disease progresses. You need to know the typical patient needs, and at least you need to know the latest care techniques. How can I improve myself? How can I make myself better? How can I also take care of myself in order for me to have better treatment or caregiving outcomes? So if we have proper caregiving, then we significantly improve the day-to-day life of both the patient and their families, but also yourself. You know what you're doing, you understand what's going on, you know how to take care of yourself as well as taking care of your patients. Then you also have an improved quality of life. In one of the studies I've just concluded, in the people that I interviewed, about 64% of them, of the caregivers, reported high levels of psychological distress and increased levels of depression symptoms. This is quite high. And when we went further, we realized that this had also impacted their quality of life. But this mainly happened because they were not so sure of what was going on. They didn't know. And when they started getting a bit of training to understand what was happening to their patients, we started seeing that the psychological distress levels were going down, and also the depression levels were also reducing. And interestingly, even the quality of life that was being reported was much better than when we had just begun. Feel free to ask at any point. So before we proceed, I want us to respond to this. This is something that, please unmute. There's some questions that I'm going to be asking, and unmute and tell us if any of the patients or the people you've interacted with have some of these symptoms. So here are some common things that may happen to people with dementia. Do you think that your family member, your friend, or your neighbor, or your friend's family member, or the person that you care for experiences any of the following? Please let us know which ones apply. So for example, does the person you care for have trouble remembering things that happened minutes before? Please unmute. For example, forgetting recent events or repeating questions. Sorry. Please unmute. And let this be interactive. Or you
Hello?
can type in the chat. Yes, please.
Yeah, this is Fred.
Yes, Fred.
I'm a caregiver also.
Mm.
Yeah, thank you to having me to this meeting. Let's see, first explain what is caregiver first. Caregiver is a person who gives care to people who need help taking care of themselves. That is caregiver. Duties of caregivers. Bathing and grooming, companionship and mental support and managing medication. That's the line of what the caregivers. For me, on that session, I can say this. If you were a nurse and you know how some nurse, they don't know how to care the people who have that problem, Alzheimer. And you need to know how to handle those people who have that problem. So Alzheimer, it's a very, very, very disease who can touch for the old people. Not even the old people can guess, and we can say that it's the brain disorder that destroy memory and thinking skills and eventual the ability to carry out the simplest tasks.
Good morning, Fred. Thank you for that information. Joy, I think you accommodate this sharing, which I think was supposed to be a response to your question. And we can continue.
All right.
That is Alzheimer. For me, I know.
Fred, do you still have some more tips to give us? Or is it that you're going on and off? Your line is breaking. Okay, dear participants, we are sorry for this uncoordinated troop movement, but let's continue with the sharing with Joy. If you can give an answer to her question, either in the chat or put up your hand.
All right. Thank you so much, Fred, for that addition. So yeah, we were at the point where I was asking us to just evaluate ourselves. Many of you, I'm seeing some of the questions you have, but I believe that by the end of the discussion, we'll be able to answer some of those questions. So yes, we now know who a caregiver is, though we have started from the point of what do you have, what qualifications or characteristics do you need to have as a caregiver? So I had asked that we respond, either we unmute and respond to the questions or we share in the chat. So the people that you take care of, or the people that you know, or the elderly individuals that you know, do they have trouble remembering things that happened minutes before? For example, forgetting recent events or repeating questions, do they have trouble remembering that? Or do they find it difficult to perform daily activities like managing their money, shopping?
I think we're having answers
Like showering
coming in.
themselves, dressing. Okay. So should I stop and then we look at that? Okay. Thank you. Okay, so some people are saying yes to some of the questions that I've asked. Do they also have trouble doing certain activities like brushing themselves, dressing themselves up, those usual activities, the activities of daily living? Do they struggle to identify time or place? Do they misplace things? Do they communicate differently than they did before? For example, do they find it difficult expressing themselves? Is it difficult for them to find words, or do they use words interchangeably? They want to ask for maybe sugar and then they call it something else. Do you notice that as well? Do they misplace things and they can't find them? For instance, money, their keys, or those who have phones, or their Bibles or Qurans, do they misplace them? And usually
Glasses.
glasses or a pen or knives. Eh? So usually they even start suspecting other people for having stolen their items. Does this happen as well? Do they withdraw socially, like they show decline in social activities, or they lack the urge to do things? Visitors come and they're no longer very excited to go and follow up on these visitors, to go and sit down and have a chat or talk to them. Yeah. Or do they show changes in feelings or personality, like having a lot of ups and downs? One moment they're irritable, one moment they're happy, one moment they're expressionless. Do they become more anxious than before? Some of them seem like they're speaking to the dead or people that passed on a long time ago. Have you noticed some of these things? So if yes, Someone here, Soda, is saying that yes to all the questions. Another says yes, they misplace things. They struggle to identify places. Yes, 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 yes. So these are common questions, and these are things that may happen to people that are living with dementia. So like we said, it is progressive. We start seeing some of these things earlier on. So when we see them, it is important that we go and check. We go have them diagnosed. It could be the normal process of aging, or it could be that there is dementia and it's progressing. Okay. I see something in the chat. Yes to most. Okay. If you've not had them diagnosed, please. Okay, I don't know why. Okay. So there's some common assumptions that people have about dementias and or Alzheimer's disease. When we notice that someone is having most of those things that we've just discussed earlier, we start assuming that these patients remember when they are reminded forcefully. So you try to put up whatever it takes to see that they remember. Don't you remember this? Don't you remember the other? Frustration. Also, patients are we also assume that they are unaware of their condition. The reality is that many of them are aware and they can feel overwhelmed or embarrassed. They're aware that they're losing their memory. They're aware that many of them are aware that they have personality changes, that they're aware that they're seeing things that other people are not seeing, or hearing voices that other people are not hearing. Some of them a number of them are actually aware. So many times we sit there and we even discuss the patient with friends, relatives, when the patient is listening and we think they're not aware. That makes them also more frustrated and more agitated. We also assume that these behavior issues are deliberate. And indeed, the studies that I've just concluded and some that I'm still taking part in, they are really showing that yes, indeed, people believe that these are deliberate behavior issues. If he goes and he forgets to come back, or he forgets the way home, it's deliberate. Possibly he wanted to go and take alcohol, or maybe he wanted to go and sleep in someone's home. We have all sorts of explanations as to why they're doing they're involved in this behavior, these behavior issues that we are seeing. The reality is that these behaviors are often expressions of unmet needs or confusion. So don't assume that because they went to the bathroom and they decided to pee in the corridor, don't assume that that was deliberate. It's confusion. To them, that was where the toilet was. You bring them food and they refuse to eat the food. I have a particular home where I visit, and the lady refuses to eat anything that doesn't look like meat. So when they try and bring fish, they try and bring the silver fish, she can go hungry the entire day or even for days if there is no meat. So you find that the family members and the people taking care of her are very frustrated. They're thinking, why do you refuse? I mean, this is also healthy. This is what the family can afford at this point in time. But well, to them, food should be, or source should be meat. And that is where they are stuck. So you need to understand that and don't assume that it's a deliberate move in order for you to manage and support the caregiver, to support your patient. So we need to keep in mind that dementia affects the person's brain. It is not deliberate. They're not doing these things intentionally. Dementia is common, most especially in the older population. Dementia is a disease. It's not a part of aging. It's just a disease, because there are many other older people who are aging and they don't have the dementias, but it is a disease. It happens. You don't even have to have any special qualifications to have it. As a first step, it is important to see a medical doctor if possible. If you're suspecting that your patient is presenting with the initial symptoms that we tested ourselves on, please seek help. Take your patient to get assessed. Bring them to us in psychiatry. We'll assess them. Professor Noelle and myself, Dr. Nachigude, Professor Segane, we should be able to assess, but also take to the neurologists and your primary physicians. Don't just sit and watch the space. You might be able to reduce on the accelerated progression of the illness. Not that you will treat it, but you'll be able to slow down the progression. So it's also important for you to take care of yourself as a caregiver. It's not only the patient that you're taking care of, you also need to take care of yourself as a caregiver. Because if you as a caregiver, you're not in the correct state of mind, then your care outcomes are going to be significantly flawed. So take care of yourself as well. We need to keep this in mind. So before I continue, before I proceed, do we have any questions? Let me just check here. Okay, so I believe there's someone who is responding to the questions online. But if you feel you need to stop me, please raise a hand and stop me, and we have a discussion as well. Okay.
Dr. Philippa must be keeping track, please.
Okay. All right. So from that now, I want us to look at how do we communicate with these individuals that have dementias? What are the do's and don'ts of the communication? One, it's important that we use simple and very clear sentences. Remember, as children, or when you had very young children, if you gave them many instructions at the same time, they would get confused. The same applies to when they get into the older stages and they also have the dementias. You want to use very simple and clear sentences, things that they can easily follow and keep track of and give you responses. You also want to maintain eye contact and use a very reassuring tone when you're speaking to them. Don't back. Don't, some of the people that I've interacted with, they take the food and leave it there, and they expect that the patient will be able to know that the food is here. Tell them, talk to them, make them that friend. Okay? Turn them into your friend. If you have a friend, you want to, somehow you feel compelled to support your friend in whatever way. Do the same with this individual who has dementia. And when you're talking to them, allow extra time for responses. Because you might ask something and they keep quiet. So after like a minute or two, you move to another topic. But you see, you've not given them ample time. Some of them will give you a response after 5 minutes or after 10 minutes. They are processing and trying to put together the responses that they should give you. So don't rush them. Use simple, clear sentences, maintain eye contact, use reassuring tones, allow for extra time in order for you to receive a response. Now, don't avoid using open-ended questions. You want to ask a question that is closed. You want to ask, for instance, how old are you? As opposed to, what do you think are around, I beg your pardon?
No, it's okay. You can go on.
Oh, okay. Let me use a different example. So, for example, you go to the patient and ask, "What will you eat today?" That is quite open, there are many alternatives that can come up from there. You would want to say, do you want to eat now? That is yes or no. So you want to give them questions that allow for just a singular response. Because if it's open and it's ambiguous, then they will not know how to respond to you. So you also want to refrain from arguing or correcting false beliefs directly. A patient will tell you that, you see, for example, the example I gave you of they want meat. At times, even when there's meat, they'll say, this is not the meat I want. For me, I want, what do they call it? A hoof, a chigere. That is the meat I wanted. So stop arguing. Don't argue and say, but now all the time you want meat. Now we've brought meat. I've brought this one. You don't even want it. Don't confront them that way. Get a much simpler tone and manner in which you say, okay, right now I've not been able to get that chigere, but this is still meat. Let us eat this, or you take the stew as we figure out how to get for you your chigere. You see, that is more like a negotiation with them. It's a win-win. You want them to eat, otherwise they can choose not to eat. I've gone into a home where the elderly refused to eat. The patient who had dementia, they refused to eat for a whole week, and they were emaciated. They were so weak. But the approach, they wanted to argue with them. They were forcing them. They were annoyed with them. And it wasn't helping. Then this I will mention again. Don't talk about the patient as if they are not present. I go and do home visits, and when you reach there, they start telling you, you see the problem with this one. When they forget where they put the phone, they will call you a thief. You see the problem with this one. You take this, you give them medicine, they throw it away. This person is very difficult. Don't talk about the patient as if they're not there. You want to tell them, you know what, mom or dad or uncle or whoever, there are certain things that you've been doing, and I want to share them with the Musawo who has come. And this is what has been happening. So that they also feel like they're involved in this communication. Are we together so far?
Yes.
All right, so let's take an example. Olivia has dementia and lives with her husband, Jacob. During the past few months, Olivia's memory loss seems to be more frequent. The last few times Olivia went shopping, she could not remember what to buy. She came home with the wrong things, which was frustrating. All right, so let's check our understanding with this particular example. How should Jacob approach Olivia about what happened? So everything that is up, you feel is appropriate, just check it. Do you think Jacob should leave Olivia alone and see what happens? Should Jacob ask Olivia to work harder to remember things? Should Jacob stop Olivia from shopping anymore? Or should Jacob ask Olivia how she feels about her memory loss? Possibly. Do you feel Jacob should not blame Olivia, but make a shopping list together with her each time prior to shopping? What do we think? Is this yes to all?
Yes to the last option.
Yes to the last option. Thank you, Philippa. Anyone else? Someone says no, I don't know, not what? Alexa, Christina?
I think they were answering as, each question was put.
Okay. Okay, so later on we'll come back to it and we see. Keep the answers that you have. We'll come back here and we see whether we were right. Okay. Sorry. So remember we said that there are quite a number of presentations. There are quite a number of ways in which the symptoms present. And one of the ways that are really, really bothersome to the patient with dementia is their emotional issues. So then how do we deal with these emotional issues? One, we need to first understand what are the emotional responses. We need to be able to recognize signs of anxiety, depression, and fear. There are certain things that they will not tell you, but you'll see them. You'll see how they respond to what you've asked or what you as a team, a family members team is discussing. For example, assuming we had homes for people specifically with dementia in Uganda, and as you're all discussing, I think next month, we organize and take mom or take dad to the home. We shall be seeing them, visiting them. They are not responding, but they're looking at you. They're hearing, remember? And certain mannerisms around them will start telling you that they are having emotional responses. They're having anxiety about what you guys are suggesting, or there's depression, or there's fear. They don't even know how to express that to you guys. So you need to understand these emotional responses. Then create a calm environment when you're talking about some of these very emotional topics. Use music, photos, and other tools to soothe and distract your patients. Acknowledge their feelings, and you need to provide reassurance. If they tell you they're scared, if they tell you they're sad, acknowledge that that is okay. It's what they're feeling. Let them know that they can express themselves with you. Provide the assurance. Encourage them. Tell them there's hope. We'll figure it out. Don't leave them hanging for them to be very sad. I'll share one of the families that I support. Their older person with the dementia underwent surgery. Okay, she has very mild dementia, but she underwent surgery for one of her eyes. And whenever you go, she's worried. She's like, now I no longer see far. I think I'm going to be blind. Imagine me aging I'm already old. I need to be able to see. I need to take care of myself. How am I going to do this? So she is so anxious about all these. So that is when you look out for some positives that, okay, you're not able to see far. You see double visions, but are you able to see things that are clear and close to you? Can you tell when your child or someone is in front of you? Like, oh yes, I see them very well. Like, so let us bank on that. Let us use that and be thankful that at least you still have vision, even if the other.
You're disturbing. I'm in a seminar.
Okay. Even if the other part of the bigger picture of the vision is lacking, but at least where you are, you can see colors. When they give you food, you can tell what food you're being given. You can still go to the bathroom and shower. You're still able to do. So you see that reassurance now begins to show them that instead of focusing on only the negative, which was now bringing in anxiety and depression and lots of fears, they're beginning to be appreciative and thankful. And they can now even start having a gratitude journal for themselves and be thankful for the things that are happening around them. Are we together so far? I know this is small print, but I didn't know how else I could make it bigger. Maybe you could make it bigger, your ends. Let me see. Okay, so we're going to test ourselves still. So here are some common questions that carers have. You may not want to discuss this with the person. You may want to discuss this with the person you care for. I want you to write down the responses to these questions. The first question, what are the person's preferences when they are no longer able to bathe themselves? That is a big question. For example, would they prefer a male or female to help them bathe? How do they feel about having a close family member bathe them, or would they prefer a qualified professional who is unrelated? I had a retired 75-year-old former, she was a retired midwife that I was caring for recently. And her professional caretaker was male. So when they brought the male caretaker, she became mute. So they were worried that their mom no longer speaks to them, no longer says, doesn't express herself. But before they brought the male caretaker, they didn't have any conversation. All of us are aging slowly by slowly. I want you to answer these questions about yourself, even before you think about your patient who could be having dementia or who is elderly. When you get to that point when you're not able to bathe yourself, would you prefer a male or female to shower you? How would you feel if it's your son-in-law or daughter-in-law or your daughter or your son or your grandchild bathing you? Or would you prefer someone who is professional and unrelated to you to come and shower you? Because this is intimate. So think about it, write down the answer, the questions, we'll have a discussion at the end. So what does the person you care for want to do for themselves as long as possible? What are some of those things they want to maintain doing? You need to discuss some of these questions with them as well. If more assistance is needed at home, what kind of help would the person you care for prefer now and in the future? Then, what are their wishes at the end of life? If you find it helpful, write down these questions that you might want to discuss. You can write down more questions that you think why it would be important to discuss with your patients. Are we together? Are we still together?
Yes, we are.
Okay. Okay, I think my PC has this thing of, okay, freezing. Okay, so some tips on how we need to stay connected to our patients. You want to use touch. You want to hold hands or do a gentle massage to communicate warmth. When you're discussing some of these questions, use that touch, hold their hands, do a gentle massage, communicate warmth, connection, safety, and love as you're discussing these questions, because they cause some anxiety. The emotional outbursts might happen. You also want to use music. It is truly a universal language, by the way. Play the music that the person you care for likes and music that makes them feel good. Don't play your music that you feel for you makes you happy. This is now about your patients. Play that music that they want to listen to. Some of them want to be read to. You want to try and read to them if they still want you to read to them. Try to maintain your sense of humor. This will help reduce frustration and tension. Share jokes, make them laugh, allow them to share jokes. Some of them are actually very humorous people. Don't allow them to maintain that. Talk with them about what they like and need. It's a very important conversation to have more than once as things change over time. Remember, we said this is progressive. So as things change over time, talk about some of these things. Talk about their property. How do they want their property to be managed? Who do they want to send to the bank when they're not able to go there? you know, because some of them feel, I remember some of them told me that these people want my money. All the time they're asking me for my ATM card to go and pick money, to go and they want my password so that they can pick money and buy for me things. But I don't even know how much money is left because they're the ones who know and they don't tell me. So it's important to have these conversations. Who do they want? Who do they want to do this for them when they're not able to? Who do they want to dress them up when they're not able to? When they're not able to feed, how do they want this to happen? Have these conversations frequently, but also let them be involved in determining who is going to take care of themselves. Because sometimes they don't want the people who take care of them. And sometimes they are difficult people, yes, but you want to sit and have an understanding with them. Yeah. Okay, I want to give you a moment to think about that before we go to us to the next. So of the things that I've talked about, what do you think we can add onto this list? At this point, I would like for us to unmute and share. What do you think we can add to this list? Or what have you tried to do and how has it worked for you? Some stories here would be very helpful. Yes. Engaging grandchildren is also very helpful. I've seen that very helpful as well, because they have some favorite grandchildren that they have. But then also I'll ask you, darling, to what extent do you engage the grandchild or the grandchildren?
Yeah, not excess, not single. There's a time, cemetery and receiving money and first is to take it back.
Unfortunately, I'm not able to hear your wonderful submission.
Maybe, Jared, can you put it in the chat, please?
The stories, chatting, playing. Yeah, that's very important. That's very, very important. They also help them get in touch with the child in them. Being old doesn't mean we don't have that child in us. We all do. So having children around helps them keep lively, actually. Thank you so much, darling. Anyone else? If you can unmute and share with us. What do you think we can add onto this list? What have you also tried that you think is helpful? Taking them out, very good. Learn the way they are able to communicate. Take them out where possible. It's important. It's actually very important to take them out of the house once in a while, even if to just put them outside to get some fresh air, to see some greenery. It's very important as well. All right, so let's move on to the next. So that was about the patients. There is you, the caregiver. It is not just about the patients. In order for you to have good caregiving outcomes, you also need to take care of your mental health. you need to take care of yourself. In as much as I say caring for me, you need to balance the life of the caregiver, the patient, as well as yours. I've met people who have said their marriages ended because they chose to take care of their mothers or their fathers. Others said they dropped out of school, their grandchildren, because they had to take care of their grandparents. Others say they've lost everything. They no longer work. They're no longer able to go and work because everyone they bring to take care of the patient runs away. So they chose to be the ones to stay and take care of their patients. So amidst all these, some events are adverse and quite unfortunate. It's important that you have self-care strategies for you not to just be focusing on the sadness, the depression, the sad things, the things you've had to let go. So it's important to take breaks. Where possible, respite care. If you have a place where you can take the person, if you're able to, and you can have someone to come and stand in for you, take care of your patients so that you have a bit of a break. It's very important for you as well. You can join support groups. We have one. Be a part of Purposeful Aging. Have talks like this. Make your own peer groups where you can encourage each other. Share. What is your patient doing? What do the rest suggest? They can support you in one way or another. You also need to involve yourself in healthy practices. Maintain a healthy diet for yourself. Exercise. Make sure you get some sleep in. And when you feel overwhelmed or you're beginning to start feeling overwhelmed, don't wait for yourself to tip. Seek professional help. It is okay. I want to remind us that it's okay to take a break every now and again. It's okay to ask for help every now and again. It's also okay to feel frustrated sometimes. It is okay to feel lonely sometimes if you feel that the person you care for is no longer able to meaningfully communicate with you. And knowing that, you need to also understand that as your role changes, it's important to stay connected during your journey together. Stay connected with your patients. Look out for those positive things. Make sure that you plan pleasant activities and relaxation so that your role does not become overwhelming. Ask for help because providing care to someone with dementia is tiring. Not just with anyone with dementia, but for also other long-term illnesses. It can be very draining. So ask for help. Don't believe that you're the macho man or you're God or you're the helper of, I don't know, the creator. Ask for help. Make sure that you plan well for the future. I love what Purposeful Aging is doing here. And also remember that there are many different ways to maintain intimacy and stay connected. If it's your spouse, you can still maintain intimacy and stay connected. The touch, the hug, the cuddles, maintain them as much as possible. Take care of yourself. So as we learn to take care of, I'm just going to share with us a few techniques of how we can take care of ourselves, just about 3. Now my PC, you're doing this again. Sorry, let's see. Okay, so we're going to do the basic breathing, and I want us to do it together. It's a relaxation activity. This you can do anywhere. When you feel tired, you feel you need a moment. So I want us to do it together. All the activities that I'm sharing here, I want us to do them together, and then we'll share how we feel at the end of it all. So right now, I want you to sit, and we're going to focus on your breathing because this is very relaxing. And by doing these breathing exercises, we reduce the tension. All right? Are you with me?
Yes.
Are you ready to do this with me? Okay. So if you experience any difficulty breathing, this exercise may not be the best option for you. So you stop. You're the one who knows your body better than any one of us. Huh? So write down, we are going to, I believe we are all sitting. Let us sit straight in our chairs with our backs against our chairs. Okay? If you're standing, I want you to stand up straight. Now, I want you to put both your feet flat on the surface, on the ground, for grounding purposes. Make sure that your feet are firmly on the ground. Now, I want you to keep breathing like you're used to. Just breathe. As you do this, try to feel how you breathe. Put your hand on the stomach, on your stomach, to try and feel how you inhale and exhale. So now I want us to exhale from your mouth and pull in your stomach as much as possible. Okay? So follow your breathing in this manner, a couple of breaths more, and then stop the exercise. So you can now do it on your own. If you're sitting, sit down, sit up straight in your chair with your back against your chair. Put your feet flat on a surface. Pay attention to how you're breathing, how you're taking in air and how you're exhaling it. Just keep breathing normally. Then get a hold of your hand and put it on your stomach so that you feel the different movements on your stomach with each breath you take, when you breathe in and breathe out. So when you're breathing out, I want you to breathe out through your mouth. And as you're doing that, pull in your stomach as much as possible. Do this for a couple of times. And then we can stop. Okay, so how does this make us feel? For those of us who have tried it, how does it feel? Feel free to unmute. Okay, Nina feels relaxed. Okay, so let's try another. So we're going to do now, still breathing, but we're going to do mindful breathing. So this exercise will help you feel calm and reduce stress as well. You're going to breathe with your stomach according to a rhythm. This is going to take us about 5 minutes, okay? So sit straight in your chair and make sure your face and shoulders are relaxed. Don't be tense, just relax yourself, your face and your shoulders. So bring your hands to your stomach and breathe into it. So you're going to breathe and feel your stomach expanding when you take in the air. And when you exhale, you should feel your stomach flattening. Okay? So we're going to breathe in for 4 counts. We're going to breathe in and count up to 4 as we breathe in. Ready? We breathe in. 1, 2, 3, 4. Now let's breathe out and we're counting up to 8 slowly. 1, 2, 3, 4, 5, 6, 7, 8. This should be at your comfortable pace. Your stomach should expand with each breathing in and contract with each breathing out. Once you've done that, you return to your normal breathing and spend 1 minute just observing your breathing and noticing how you feel. As you're doing this, practicing listening to your own thoughts without being judgmental. Don't negatively judge yourself. If your mind wanders away, refocus on the breathing and meditation. At times, it's good to have a mantra that as you're breathing, just recite that mantra. I'll overcome this. I can do this. We shall, whatever, something positive that you can tell yourself, but you're not speaking. You're reciting it in your mind. All right? And then the last one I'm sharing today is the relaxation activity, and we're going to do the neck movement. So with this exercise, you need to feel less tension in your neck. It will also increase the blood flow to your brain. This also takes just 5 minutes. And this is how we do it. Make sure to move slowly with attention. Bend your neck forward and backward, but slowly. Forward and backward. Let's do it like 5 times. Forward, backward. Forward, backward. Forward, backward. Forward, backward. So while we do this, now we're going to do this, and I want you to inhale or breathe in while you lift your head up and back. Breathe in while you lift your head and back. And breathe out while you drop your head, while you drop your chin to your chest. Okay, so we breathe in and we lift our heads up and back. And breathe out when you drop your chin to your chest. Now rotate your chin from side to side, slowly. So when your chin is in the center, breathe in. And when you look to the side, you breathe out. In the center, you breathe in. To the other side, you breathe out. And then drop your ears towards your shoulders. Each side, 3 times. So when you're in the center, you exhale. When you drop your ear to your shoulder, when you're in the center, you breathe in. When you drop your ear to the shoulders, you breathe out. And you can do this 5 times. All right, those are some of the people that I work with when I'm giving the caregiver trainings. And I want us to know that dementia care is not rocket science. It is heart science. Thank you very much for listening to me today.
Wow. Joy. Thank you so much. Thank you so much for this exposure. I think it has touched many of us. It has touched us in the best way possible, beyond expectation. Yes. I don't know how relaxed I've been because I've been yawning throughout all the exercises. Yeah. Yes. Thank you so much. I'm sure there are many stories we can continue with in the brief time we have left. And I would like to pass this session on to Dr. Philippa to take us through the hands, the questions, the comments in the chat, and those who put up their hands to share. I think there's a lot to share. There's a lot to share, a lot to plan. So over to you, Dr. Philippa.
Well, thank you very much. Okay, sorry, I had an extra device which was creating an echo. Right, thank you so much, Joy, for what you have for taking us through this session. As we wait for people who may want to voice over, I'd like to ask for, rather to go through some of the questions that we had earlier. Someone asked, how do you educate the patient that they actually have the condition, because some are not aware. And then there was a question about whether it's safe to talk to the patient about spiritual issues. And then I see another hand up. Give me a minute, scroll down. Okay, thank you for the wonderful presentation. And there's a question about what is the best age profile for a caregiver that is assigned to handle a dementia patient. You could take those questions, Joy, as we wait for others. Over to you, Joy.
Is it me? But I don't seem to hear you, Dr. Philippa.
Dr. Philippa, please raise your voice. You're very faint. I could not also get everything you say.
Sorry, can you hear me better now?
A little better, please. It's not loud at all.
Okay, maybe can I ask Joy, since we are running out of time, Joy, can I ask you to just look at the chat? There were 3 questions which we hadn't answered. One was about how to educate the patient that they actually have the condition of Alzheimer's, because some are not aware. And then how safe it is to talk to the patient about spiritual issues. And then a question about the best age range for caregivers for patients with Alzheimer's.
Okay. So let me respond to, let me start with the best age range for caregivers. From what I've seen in the field, there is no age range. Some of the elderly that I've interacted with, their caregivers are as young as 12, 13, 14. But of course, there's much that they're not able to do. But some people also have caregivers that are, like in their 70s, 60s. So I think it's important, one, to share with your patient and find out from your patient, what do they feel is best for them? What are the characteristics of the person they would want? And also the person you get, are they compassionate? Because where you are not, many things happen. I've heard of stories of caregivers that have abused physically, verbally, sexually, the patients that they're taking care of. So you want to know the characteristics of the caregiver that you're getting, and to know that, to also give them like the proper trainings or every now and again for for them to achieve what they want. The personality of the caregiver is also very important, because if someone is not a patient person, they might not be able to actually care for your patients. Then talking about spiritual issues. Now, many of our older people, they have things they want to talk about. Some of them believe, their beliefs might not necessarily be yours. So it is safe to let them freely share what they feel they want to share. But then don't impose your beliefs on the patient unless the patient is the one who feels that they need to hear your point of view as well. What was the other question, Dr. Filippo?
The question asked how you can educate patients that they
Mhm.
have the Alzheimer's condition, because some of them are
Okay.
not aware.
And it's important for them to actually be aware. You let them know, you share with them the different symptoms, but don't do this in a derogatory manner. For example, the word for Alzheimer's in Luganda is okuwuta. You don't tell your patient that kakati or wuse, I don't know whether that's how they say it. But you tell them, you pick on the symptoms and say, for example, right now, you're beginning to forget most of the things. And then you're also presenting with this and the other. This possibly means that you have a disease, which we are managing. So you don't do it in a derogatory manner. Give them the information, but not in a way that is going to scare them and also make them feel like it's the end of the world for them. Yeah. So there's a hand raised as well.
Yes, Sarah, you please go ahead and unmute.
Hi, this is Sandra. Can you hear me?
Yes, Sandra.
Yes, we can.
Thank you. Thanks for this presentation. My question really goes to patients who sort of are up and down, but they have periods when they're really, really down in terms of the confusion seems to be exacerbated or the anxiety is heightened. I do take note that you have advised that sometimes they need to interface with a psychiatrist to deal with some of those issues. Are there certain medications that can be given to minimize some of the heightened issues during those seasons? And what are those, or are you able to tell us what interventions the psychiatrist might give if there is any medication that can be prescribed? Whether that is possible, if you can tell us some of that information here. That's one thing, that's one question. The other question is about some patients seem to have a lot of urinary tract infections, a lot of infections that seem to heighten the confusion. Is there a connection with that? And how are carers, what are some of the things that carers can do to try and help and minimize the frequency of those infections? Thank you.
Okay, thank you very much, Sandra, for your questions. I'll start with the medications. Oh, let me start with the UTIs. I think what causes the confusion, and I'll beg to be guided again if there's someone with a different view, but what would really cause the confusion so much at this point in time is the appearance of something that takes away their well-being, that affects their physical well-being, not really the UTI per se, unless it is kind of like neurosyphilis or something. But the fact that there's a disease, an illness that has also now come in and it's making their lives difficult, I think that would heighten. I don't know whether it's confusion, but it would make them feel agitated and quite more irritable. So how you manage this, the cleanliness is very important. The person who is taking care of this patient needs to, if the bathrooms are shared, they need to take extra care cleaning the bathrooms, or even when they are not shared, but they need to be very clean. The things that their clothing, their beddings, just generally the general cleanliness should be on point, for lack of a better word. And then when it comes to the medication, yes, there's what we call there are the different associated disorders that come with the dementias, and depression is one of them. Severe anxieties, hallucinations, delusional disorders, and these are managed. So that's why you need an interface with your primary psychiatrists to assess and see what exactly are the symptoms that your patient is presenting with, and then they can give medication in the correct regimen for the patient. So that also calls for constant reviews, so that you know whether they need to increase the medication, or they need to reduce on the medication, or maybe do a combination of medications. But then also the psychological therapies help. So working hand in hand with the psychologists and psychiatrists will also go a long way in emphasizing better treatment outcomes for your patients. Hope that answers your question, Sandra.
It does. Thank you.
You're welcome.
Okay, good. I had, since there's no hand up and no new question, I'll ask just one more question for the benefit of everyone. You mentioned that you do some trainings and some support groups for carers. Do you mind giving us some information on where these groups are, if they are free for anyone to join, and what kind of training you give for the caregivers?
Okay, so initially I've been doing these trainings as part of my studies. So right now, if there's an organized group of people who can come together, they can call me and we come up with a schedule and terms of how we can do the trainings for their caregivers.
Okay.
Yeah. There's not a specific place, but just like we've had a training here, we can still come together and organize like specific trainings for the caregivers to talk about, like the disease, the cause of the disease, what things that need to be done, and and caring. And we actually go deep as how we can manage the different symptoms that they present with as well. Yeah.
Oh. All right. Thank you, Joan.
Yeah.
Excuse me, I asked a question about this prevalence of dementia among women in the population. Does Joy have any figures on that? Thank you.
So we don't have countrywide prevalence yet, but some studies, I know that Professor Noeline has done a study, but it was within the hospital-based patients, and the prevalence was about 6.3% of the patients within the hospital, elderly patients within the hospital, who presented with dementia. Now, this was broad range dementia. It could have been HIV, it could have been related to other things as well. Then there's a study also by, I think he's called Ainamani, who did some community prevalences in southwestern Uganda. And within the community, he found that, I think it was the prevalence was about 18%, which was a bit high. So there are also some other ongoing studies, but we don't have like a countrywide prevalence for dementia. But one thing for sure that I can tell you, even in the studies that I've been doing, dementia is there and it's increasing. It's kind of like a time bomb, because many people are there, they have their patients, they're doing different other things for them. They've not had formal diagnosis. But when you interact with them and you give some tools, they show symptomatology that would actually be of a dementia.
Thanks a lot. I'm Sula Bernard.
All right, thank you, Busula, for the question, and thank you, Joy, once again. I think my microphone might have issues. Can everyone hear me? Or maybe at this point, let me hand back to the moderator to close the session.
Thank you very much, Dr. Philippa. Earlier on, we had a suggestion for sharing with someone doing some work in Soroti. Is that still possible? Because we have a few minutes left.
I'm sorry, moderator.
Hello.
I definitely.
Hello. Good morning, everyone. Thank you so much for the opportunity. Thank you so much for the opportunity to share with you. My name is Ella Mokure, and I'm here in Soroti. I am a registered nurse and also working with an organization that supports elderly persons. Currently, we are having a number of 311 that we support directly, and then quite a great number, about 1,000 that we support, we reach out to indirectly, maybe when we have sensitization programs. But the ones that we visit in their homes, we have 311 of them. But before I go to talk about that, I want to extend great appreciations to the team, Purposeful Aging. I heard about this program, I think about 2 months ago, and I have really been wanting an opportunity to hear from you, to learn from you, and I'm so inspired. Thank you, Joy. Thank you, Fred, and everyone that has put this information together in order to support us. In my team, we happen to have 2 medical persons, and then the others are not medical. They did other courses, but we try to do caregiving support in our own means that we can. Basically, it is been on the social aspect and reconnecting some of these beneficiaries to their families. So when we reach out to them, today I have been able to learn a number of things from you, that some of the things we could have been dealing with is dementia, and the cohort of the people that we've been dealing with are focusing on those ones who do not have anyone to look after them, fighting isolation, loneliness, neglect, and abuse, mainly among the elderly. So they are those ones that live alone. There is no one who lives with them, and they take care of themselves. And when we reach out to their homes, they even sometimes forget that we were there the past week. And when you come to, they feel like you've been away for a whole week. They are very upset. They are very annoyed. But as you continue to interact with them, they cheer up. And now that we have learned this, other ways that we can deal with them, talking about playing music, interactive sessions, I think it's going to be good for us. And I also wanted to know if it is possible to see how I can maybe arrange, maybe to know more about what you do, and see how we can be able to work together and support the elderly population that we have in Uganda that is growing rapidly. I think if it is okay, I can type in our website, and anyone at your own time, you could look into our website, and then you can see maybe the details of what I may not be able to share here with us. Thank you so much. If there's any question, maybe someone can ask me, but if not, you could just reach out to our website, and then you can just write to us, and you can hear more. But I would also want to request Purposeful Aging, if it is okay, we could scale up some of these online meetings with other partners, or with other people that are interested, or people who are taking care of these persons. Looking at the fact that in Uganda, we do not have a direct elderly home that takes care of, that focuses on some of these diseases. It's just general. So this information could really be of help to very many families, and people could receive this elderly care at their homes if it is okay. Thank you.
Thank you very much. Dr. Philippa, do you want to take on this question?
Okay, before I take on the question, there's a question I got about for Joy. Someone has asked how you can care for how you help a carer who needs help. The carer wants to do, well, it's a family member, and
I'm not able to hear.
one of the people in the family is wants to do everything on their own and doesn't allow other people to participate in caring for the patient. However, this person might not be doing everything right, and they're very paranoid about any other person coming in to help. So they want to know what guidance you can give for them to be able to help this carer and also help the family get some kind of cohesion within themselves. Over to you, Joy. Joy, were you able to hear the question?
No, I had Joy.
Oh.
I was asked to ask about help, that if there's any help for a carer, for carers who need help. For example, a carer who's not allowing other family members to help in the caring for the patient. They want to be the only one to do them. Sorry?
You were asking if there was any?
If there is any help for a carer who, let's call it paranoid, and is not willing to allow other family members to help in caring for the patient. Yeah, so this person may not be doing everything right, and other people might be able to come in or want to come in to help, but they're not given a chance to help. What advice or what help would you give for such a person or for such a family which is struggling with an issue like that?
So we can take them through some family therapy. And during the family therapy and the family support, we can talk about how they can learn how to share the responsibilities and all, and also have a one-on-one interaction with him or her to get an understanding of why they feel they should be the ones to carry the load alone.
Okay,
so just get in touch.
Okay, they would need to get in touch to have like a specific intervention.
Yes, please.
Okay. All right, thank you. I'm not sure if this is a new hand, Sandra. If it's a new hand.
Yes, it is. It is my new hand. My apologies. Can you hear me?
Yes, we can.
Yes.
Okay, thank you. My question goes to caring. A lot of the caring is done by family members, and you've mentioned that there is fatigue that happens. Are there? Can you connect to professional carers outside of family? Is there a place somebody can call to organize, short time respite care, even if it's 2 months, a few months? Do you have a contact where we can get that sort of service and assistance?
Yes, we have. Okay, they might not necessarily be trained in dementia care, but I know there are quite a number of caregiving groups that have come up.
Sure.
The one that there's one in Butabika Hospital. At least works with them. The rest, I think you need to just read about them and visit them and see what they do. But there's one in Butabika Hospital. They seem to have you know, like they seem to have some good skills there. So we can always share the numbers when on a need to know basis so that people can
Thank
reach
you.
out to them. Yeah.
Thank you.
Mm.
Yes, there are also church-based or religious-based, like where Fred comes from in Zambia. It's been there for a long time, but as Joy put it, it's general care for the elderly. Then there's one based in Chibuli. There are several actually, even individuals based on like location. I know someone who has been doing this real care for elderly for a long time. I think she did that abroad and then she retired, but is continuing in the same, but it's also on a personal basis. You just have to get in touch and then we direct you to the place.
Okay, thank you.
Yes, I think, thank you so much, everyone. Thank you so much, our presenters, Joy and Fred, and all of you for participating actively. We realize, all of us, that there's a lot to be done. There's a lot we may not have been doing well or as best as possible, but we've got a lot of tips for us as caregivers and tips into the disease itself. We need to know what the disease is before we can really give good care for it. Yes, there's been there are many links we need to make as individuals and as purposeful aging. We thank you so much for the information from Sorority and elsewhere. I'm afraid we have actually overshot the usual time, but I'll urge every one of you to please look at our past sessions. They're all available on YouTube. And if you don't have the link, please just get back to us on WhatsApp and Gmail. Usually, Dr. Philippa puts it in the chat room, and we continue sharing and putting our forces and heads together, because the problem of Alzheimer is here with us and is growing, and we do need to help each other to deal with this. And as planned out to age purposefully ourselves, we should not feel shy to share what the initial symptoms are, because as we've been told, there is hope for those other attending illnesses to be dealt with. And the earlier we do, the better. You remember we had Dr. Noelina and Dr. Zawede, and Dr. Zawede specifically said you could visit her and get a checkup, get an assessment of your mental, I don't know what it is, your assessment mentally, to see how far or how good you are at a fee. I think she said a fee of 20,000. Let's keep in touch and benefit from all these available services around us. I want to once again thank you so much for listening in. Thank you so much for being patient for this 1.5 hours, which has become 2 hours. Thank you so much, our presenters, Joy and Fred. We're sorry for the each glitches. we thank the host, our Purposeful Aging team, and all those who have shared with us. Thank you. Thank you so much. Let's keep aging purposefully. We shall get there.
Thanks, everyone. Goodbye.